everyone, and welcome to our Monday Minute. Today we're going to discuss the ICD-10 coding update that will go into effect October 1st. In April each year there is also some changes. Sometimes there are no changes at all, but there is an April and October update, typically, and the October update being the largest. In April, there were no new codes, but there were some official guidelines and convention changes, such as COVID-19 no longer being able to be diagnosed with just a positive test. There must be provider confirmation. In addition, obesity codes must have a specific class assigned, and the obesity class code must come from a provider. You also may add a BMI code as well, based on clinical documentation of height and weight. So for October, there are a ton of changes, 487 additional ICD-10 codes with 28 deleted and 38 revisions. The primary change was 111 new codes added for capturing non-pressure ulcers, and there are tons, 111 of those. There are 3 new codes for malignant inflammatory neoplasm of the breast. There are multiple codes for multiple sclerosis that have been added, and thyroid eye disease. In addition, as we have discussed numerous times, CMS continues to collect data on social determinants of health. In that round, they have added some new diagnosis codes in October that specifically address patients' financial insecurity. Because of some of the social determinant of health items that were proposed previously, we are expecting the possibility of a new OASIS in 2027. We want to stress to you how important it is not only to understand the new diagnosis codes, but to understand how drastically important coding is, both for home health and hospice. From a home health standpoint, ensuring that primary diagnosis is a PDGM acceptable diagnosis with a Medicare patient, and that any comorbidities the patient might have not only make it to the plan of care, but also make it to the claim so they can be utilized in the calculation of your PDGM payment. Please ensure that anyone who is coding for you fully understands that they must have physician or practitioner documentation to support the coding that they put onto a home health or hospice claim. That cannot come from your nurses and cannot come from just the patient verbally telling you that they have that diagnosis. Confirm that you have provider information to back that up. One last coding thing I want to clarify. From a previous Monday Minute, we discussed an edit that was occurring with claims where primary diagnoses for dementia that had been ruled out for some outpatient settings were not supposed to affect home health. They did begin putting home health claims into T status if those specific dementia codes were being utilized. That edit has now been corrected, and you need to personally refile those claims or release them from T status, and they should now pay. Thank you for listening today. Healthcare Provider Solutions stands ready to assist you with any ICD-10 coding needs that you might have. And all of these new codes, as well as OASIS updates, will be discussed in detail in our 2-day home health workshop coming up in August in Nashville, and we hope to see you there. Have a fabulous week.